If you're a man over 60 and there's been a moment where you reached climax but didn't see any semen come out, I want you to stay with me right here. Don't click away. I'm Dr. Claire Weston, a urologist, and in over 20 years of practice, I've sat across from hundreds of men who've experienced exactly what you're describing. Some of them whispered it to me like it was the most shameful secret they'd ever carried. Some of them had tears in their eyes. Not from physical pain, but from the weight of staying silent for months, sometimes years. And here's the very first thing I want you to hear. You are not alone, and this does not mean you've lost your manhood. I know that's probably not what the fear in the back of your head is telling you, but stay with me, because understanding what's actually happening in your body is the single most powerful thing you can do right now. I've had patients, grown men, strong men who'd worked hard their whole lives, who stopped being intimate with their wives entirely because they were terrified she'd notice. Their marriages went cold, their confidence disappeared, all because nobody had ever explained to them what was going on. That ends today. In this video, we're going to walk through this together. What dry orgasm actually is, how a normal ejaculation works, so you understand why this happens. The most common medical causes, the warning signs you should never ignore, the emotional side that nobody talks about, and real solutions that exist right now. So let's get into it. Because talking about this openly, without shame, is the best thing you can do for your health. Before we can understand what's going wrong, we need to understand how things work when everything's going right. Because once you see the full picture, a lot of the fear just falls away. Semen isn't one single thing produced in one single place. It's actually a mixture from 3 different sources. The sperm themselves come from the testicles, but here's something most people don't know. Sperm only make up about 1% of the total volume. Just 1%. The bulk of it, roughly 60 to 70%, comes from the seminal vesicles, which are 2 small glands tucked behind your bladder. They produce a fluid rich in sugars that gives sperm the energy to travel. And finally, the prostate contributes its own fluid, packed with enzymes and minerals that protect sperm and help them on their journey. During orgasm, all of this comes together in the urethra, like rivers merging into one. Then a series of rhythmic muscle contractions in the pelvis push everything out. It's a finely coordinated process. Nerves, muscles, glands, all working together like a well-rehearsed team. When something disrupts that coordination, the orgasm can feel completely normal. The pleasure, the intensity, all of it. But the fluid doesn't come out. And that's when the confusion starts. So what exactly is a dry orgasm? It's when you reach climax, feel everything you're supposed to feel, but there's no visible semen. To the outside world, it might seem like a small thing. But for the man living it, it's anything but small. Patients have told me it feels like the body goes through the motions, but something's missing, like the signal fired, but the delivery didn't happen. And what follows that experience, at least for most of the men I've seen, is a complicated mix of emotions. Relief that the desire is still there, that things still work in that sense, but anxiety about what the absence means, and often a growing sense of shame around their partner. Here's something important. Orgasm and ejaculation are not the same thing. They feel linked because they almost always happen together. But orgasm is the neurological event, the wave of sensation, the pleasure. Ejaculation is the physical act of expelling fluid. When the first happens without the second, that's a dry orgasm, and it has a medical explanation. Almost always. Now let's talk about why this happens. Because there are several distinct causes, and knowing which one applies to you is how you figure out what comes next. The most common cause, and I see this constantly in my practice, is something called retrograde ejaculation. Here's how it works under normal circumstances. When you reach orgasm, a valve at the base of your bladder snaps shut. That closure forces the semen in only one direction, forward through the urethra and out. But in retrograde ejaculation, that valve doesn't fully close, so the semen takes the path of least resistance and flows backward into the bladder instead. You feel the orgasm, you feel the contractions, but nothing comes out. And if you notice your urine looks cloudy afterward, that's actually the semen that went the wrong way. Why does this happen? The most frequent reason I see in men over 60 is prior prostate surgery. Procedures like TURP. transurethral resection of the prostate, which is very commonly done for enlarged prostate, can affect the nerves responsible for closing that bladder valve. Certain medications can also cause this. Some blood pressure drugs, tricyclic antidepressants, and drugs used to treat urinary symptoms from an enlarged prostate. Neurological conditions play a role too. Poorly controlled diabetes, multiple sclerosis, spinal cord injuries. Even pelvic radiation therapy can leave scar tissue that interferes with the process. The diagnosis is straightforward: a urine sample taken right after orgasm. If it contains sperm, that's your answer. Now, I want to tell you about a patient I'll call David. He was 61, a retired firefighter from the Pacific Northwest, a guy who'd spent his whole career being strong for other people. He came in about 8 months after prostate surgery, and he was devastated. Nobody had warned him this might happen. He thought something had gone terribly wrong. He told me he'd been researching online at 2 a.m. and convinced himself he was seriously ill. When I explained to him that his pleasure, his desire, his sexual capability, all of it was completely intact, that the only thing that had changed was the direction his semen traveled, I watched his whole body relax. He said, "So I'm not broken?" And I told him, "You are not broken, not even close." That conversation is one I've had more times than I can count, and it never gets less important. Retrograde ejaculation, when it results from surgery, can be permanent. But I want to be clear. It does not take away sensation. It does not reduce your masculinity. And for men who want to conceive, there are assisted reproduction techniques that can still make that possible. Another cause I see regularly is a blockage in the seminal vesicles. Those glands I mentioned that produce the majority of semen volume. When they get blocked or inflamed, the fluid they normally contribute just doesn't make it out. The orgasm happens, but the volume drops dramatically, sometimes to nothing. What causes the blockage? Old infections are a big one. Prostatitis that wasn't fully treated, or repeated urinary tract infections that leave scar tissue in the ejaculatory ducts. There are also seminal calculi, which are essentially small stones, similar to kidney stones, that can partially or completely block the passage. Some men have congenital cysts, meaning small structural abnormalities they were born with that never caused any symptoms until later in life. Pelvic trauma or past surgeries can also narrow or close off those ducts over time. The symptoms that point toward this cause include pain deep in the pelvis during orgasm, semen that looks unusually thick or clumpy, very low volume over time, or unexplained fertility issues. A transrectal ultrasound can show the vesicles clearly, reveal cysts or inflammation, and a semen analysis can pick up telltale signs like low volume or absence of certain compounds the vesicles produce. I'm thinking of a patient, I'll call him Robert, who was in his mid-30s, came in with his wife after 3 years of trying to conceive without success. His desire was fine, erections were fine, but his semen volume had been getting lower and lower. We found an obstructive cyst in one of his seminal vesicles. After minimally invasive endoscopic procedure to clear it, fluid flow was restored. 3 months later, he called to tell me his wife was pregnant. That's the kind of outcome that reminds you why this work matters. The good news is that these blockages are very treatable. Depending on the cause, options range from a course of antibiotics or anti-inflammatories for infection-related cases to that same type of minimally invasive endoscopic surgery for stones or cysts. Recovery is typically fast and results are really positive. The third major cause is hormonal, specifically low testosterone. I want to spend a little time on this one because it tends to get underestimated and it affects a significant number of men over 60. Testosterone is produced primarily in the testicles and it does a lot more than most people realize. It's the hormone that drives sperm production and keeps the accessory glands, the prostate and seminal vesicles, functioning properly. When levels are where they should be, the whole system works. When testosterone drops significantly, the system starts to break down. In the early stages, you might notice that semen looks lighter, more watery, lower in volume. Then comes decreased libido, erections that aren't as firm, orgasms that feel less intense, or that produce little to no fluid. Alongside all of that, you might be experiencing fatigue that doesn't go away with rest, loss of muscle mass, more belly fat than you used to carry, and disrupted sleep. Here's something I tell my patients all the time. A lot of men chalk all of this up to just getting older. And I understand why. But getting older doesn't mean you're supposed to feel this way. Low testosterone is a medical condition. It's treatable. And it doesn't have to be your normal. Diagnosis involves a hormone panel: testosterone total and free, LH, FSH, prolactin, and thyroid hormones. Timing matters here. Testosterone levels are highest in the morning, so that's when we measure them. A level below 300 nanograms per deciliter typically indicates a deficiency, though I always interpret the numbers alongside what the patient is actually experiencing. There are two types of hypogonadism: primary, where the testicles themselves aren't responding to hormonal signals, and secondary, where the problem is upstream, in the pituitary or hypothalamus, which aren't sending the signal to produce. Treatment depends on which one it is. Testosterone replacement therapy, whether injections, gels, or patches, can significantly improve energy, libido, muscle mass, and semen volume. However, for men who still want to father children, replacement therapy isn't the right approach because it can suppress your body's own sperm production. In those cases, we use medications that stimulate your body to produce testosterone naturally. Things like clomiphene or gonadotropins. I had a patient, I'll call him Frank, 63 years old, came in exhausted and deeply worried. His wife had noticed the changes before he even fully acknowledged them himself. His workup showed secondary hypogonadism. We started a stimulating treatment protocol, and within a few months he was a different guy. More energy, better mood, his intimate life back on track. He told me at his follow-up, "I forgot what normal felt like. Now I remember." Now I need to talk about warning signs, because everything I've described so far, retrograde ejaculation, blockages, low testosterone, these are real issues, but in most cases they're manageable and not life-threatening. However, there are specific situations where a dry orgasm is your body sending a serious alarm, and I need you to take these seriously. The first red flag is when it happens suddenly, with no explanation, no recent surgery, no new medications, no gradual change, just a sudden shift. Your body doesn't change that dramatically overnight without a reason. When it does, that warrants an immediate evaluation. The second warning sign is when dry orgasm comes with other symptoms: pain during orgasm, blood in your urine or semen, loss of genital sensation, or a sharp and sudden drop in sexual desire. These combinations can indicate infection, neurological disease, or, and I want to be honest with you here, a tumor. Yes, in some cases, a dry orgasm can be one of the first visible symptoms of prostate, bladder, or testicular cancer. These tumors, as they grow, can obstruct the ejaculatory ducts and block semen from exiting. That's why, if you notice difficulty urinating, pelvic pain, or blood, along with a sudden change in ejaculation, please do not normalize it. Go get evaluated. The third critical scenario is if you're in your 40s or 50s and still hoping to start or grow a family. Dry orgasm is a direct obstacle to natural conception, and while assisted reproduction techniques can absolutely work, time matters. Don't wait. I'm not telling you this to scare you. I'm telling you because the difference between catching something early and catching something late can be enormous. The men who come in early, even with scary symptoms, almost always have more and better options. So please hear your body when it's talking to you. I want to take a moment to talk about something that doesn't show up on lab results, but is just as real as any of the physical causes I've described: the emotional and relational impact. When a man over 60 starts experiencing dry orgasm, the toll it takes isn't just physical. I've had patients in my office who were absolutely composed in every other area of their lives, successful, respected, stoic, and they sat across from me and fell apart. Not because of pain, because of shame, because of fear, because of the silence they'd been carrying. The absence of semen, even when pleasure is completely intact, triggers something deep. A lot of men interpret it as proof that something is fundamentally broken in them, that they're less of a man, that they failed their partner somehow. And that thought, whether or not they say it out loud, changes behavior. They start pulling away. They make excuses. They avoid intimacy. And on the other side of that dynamic, the partner notices. She doesn't necessarily know why, but she feels the distance. She may interpret it as rejection, as loss of desire, as something she did wrong. Neither person is talking. Both are suffering. And a marriage that was fine, maybe even great, starts to quietly unravel over something that has a medical explanation and, in most cases, a real solution. I had a patient. I'll call him George, 68 years old, from the Midwest. He'd been with his wife for 42 years. He told me he'd spent almost 9 months avoiding any physical closeness because he was terrified she'd notice his orgasms had changed. His whole marriage had gone cold. He'd been sleeping in the guest room, blaming his back. When he finally came in, we found that his dry orgasm was a result of his long-standing diabetes affecting his autonomic nervous system. A known complication, very manageable once identified. Once he understood that this wasn't a sign that he was done as a man, that it was a consequence of a medical condition and not some personal failure, he cried. Right there in the office. And he said, "I wasted so much time. Please don't waste your time. Talk to your doctor. Talk to your partner if you can. You don't have to carry this alone, and the silence is almost always worse than the conversation." So let's talk about what can actually be done, because I don't want to leave you with a long list of problems and no path forward. Treatment always depends on the cause, which is why the first step is getting an accurate diagnosis through a urology evaluation. Don't skip that step. Don't try to troubleshoot this on your own based on what you read at midnight. A proper workup makes all the difference. If a medication is the culprit, which happens more often than people realize, sometimes simply adjusting the dose or switching to a different drug under medical supervision is enough to restore normal ejaculation. I've seen that work beautifully in patients who'd been dealing with this for years. For retrograde ejaculation, certain medications can help tighten the bladder neck valve to encourage forward ejaculation. Results vary, but for some men, it makes a significant difference. If the retrograde ejaculation is the result of surgery, it may be permanent. But again, the pleasure remains. And for fertility purposes, sperm can be retrieved from urine or directly from the testicle. For seminal vesicle blockages caused by infection, antibiotics or anti-inflammatory medications are the starting point. If there are stones or cysts, minimally invasive endoscopic surgery can clear them out and restore flow. Recovery is typically quick. For hormone-related causes, testosterone replacement therapy, through injections, gels, or patches, can improve energy, mood, libido, and seminal volume substantially. For men who want to preserve fertility, clomiphene or gonadotropin therapy stimulates your own body to produce what it needs. And when fertility is the primary concern, reproductive medicine has come an incredibly long way. Sperm can be retrieved from urine after retrograde ejaculation, or extracted directly from testicular tissue. Techniques that make it possible for men to conceive even in complex situations. The bottom line is this: don't give up. Don't assume this is just how things are now. There are real options at every stage, from simple medication adjustments to more involved procedures, and the men who seek help almost always find it. Beyond medical treatment, there are everyday habits that genuinely make a difference for sexual health in your 60s and beyond. First, stop suffering in silence. Talk to a doctor. I know it feels embarrassing. I know it's not the conversation you want to have. But every man I've seen who finally came in said the same thing. They wished they'd done it sooner. Every single one. Second, manage your chronic conditions. If you have diabetes, keep your blood sugar controlled. If you have high blood pressure, stay on top of it. I've seen guys whose dry orgasm symptoms improved meaningfully just from getting their glucose under better control. Your systemic health and your sexual health are not separate categories. They are the same category. Third, lifestyle matters more than people give it credit for. A diet rich in fruits, vegetables, and lean protein reduces inflammation and supports hormone production. Regular exercise, even just 30 minutes of walking most days, improves circulation, testosterone levels, and energy. Sleep is non-negotiable. Your body produces a significant portion of its testosterone during deep sleep, so if you're running on 5 hours a night, you're leaving a lot on the table. And please don't just grab supplements off the internet without talking to your doctor first. Some of them interact with medications or interfere with treatments in ways you wouldn't expect. And finally, remember this. Sexuality doesn't have an expiration date. It changes, yes. The body at 65 isn't the same as the body at 35. But that doesn't mean it's done. With the right information and the right care, intimacy, pleasure, and connection absolutely remain possible. I've seen it in my patients over and over again. So here's where we land. A dry orgasm isn't just a minor quirk you should quietly accept and file away. It can be the result of surgery, medication, a hormonal shift, or a structural blockage. In some cases, it's a warning sign of something more serious that needs attention now. And, in every case, it deserves to be taken seriously. But here's what I need you to hold on to. It does not mean you've lost your masculinity. It does not mean your intimate life is over. It means your body is sending a signal. And signals deserve a response, not silence. I've watched men walk out of my office with an entirely different posture than they walked in with, not because I fixed everything immediately, but because they finally understood what was happening. That knowledge alone gave them back something they'd been missing. And that peace, that relief is available to you too. The greatest thing standing between you and that relief is the decision to make the appointment, have the conversation, and stop waiting for this to resolve itself on its own. Your body's talking. It's time to listen. If this video was helpful to you, drop a comment below, especially if there are specific questions you'd like me to address in a future video. Share this with someone who might need it, and subscribe so you don't miss what's coming next. We've got a lot more ground to cover together.